Welcome to Family Basics 101. I'm Dr. Bruce McClure, and as we continue our 5-part series on mental illness, today we will talk specifically about bipolar disorder. The National Institute of Health defines bipolar disorder as follows. It is also known as manic depressive illness. It is a brain disorder that causes unusual shifts in moods, energy, activity levels, and the ability for an individual to really carry out their day-to-day task. The first episodes of manic depressive disorder are typically first recognized in the teen years, and it is fully manifested by the time the individual is about 25 years old. The detection of bipolar disorder is not very easily recognized, especially during the early developmental stages. During the teen years, it is often masked because of the typical, what appears to be, the normal hormonal development of adolescence. So many times the presence of the mood shifts are simply attributed to, the child is going through this growth and the hormonal change, when in essence it's probably mixed with the hormonal development just naturally, but also you're beginning to see the manifestation of the mood shifts that are attributable more so to the imbalance of the chemicals in the brain. The Mayo Clinic defines bipolar disorder in two categories, bipolar 1 and bipolar 2. Bipolar 1 significantly is made more evident by the person's personal relationships, their jobs, as well as their schools. The manic episodes are often very volatile and very dangerous. In essence, it's during the bipolar 1 episodes that the person has very difficult times maintaining healthy relationships, the inability to maintain a stable job environment, and it's very difficult for them to function in social settings and very structured environments such as a schoolroom. Bipolar 2, on the other hand, is not as severe in nature as the bipolar 1, but it is also seen with the elevated moods. There's irritability and there are changes in the routine functioning. It's just not as severe and more vivid as it is in bipolar 1. Rather than experiencing the full-blown manic episodes as seen more frequently in bipolar 1, they are less severe, and this is called hypomanic episodes. Bipolar 2 episodes are typically evident by longer periods of depression rather than the extended periods of the manic behavior. When you look at the bipolar or manic behavioral functioning of individuals, keep in mind that from person to person, the bipolar episodes and the symptoms are going to vary. Some individuals will experience greater depression, while others may experience greater manic behaviors. Some individuals might have episodes of mania or manic behavior and depression at the same time. We call this mixed episodes, to where it seems as if the person is very high and elevated, and at the same time it seems as if depression is also equally as present. A caution about the mixed episodes. The person probably needs to be watched very closely because it's during these mixed episodes that it is more probable, not always true, but more probable that suicidal attempts might take place. When we look at the manic symptoms, look for the euphoria, the inflated self-esteem, poor judgment, rapid speech, racing thoughts, aggressive behavior, agitation or irritability, increased physical activities, risky behaviors, spending sprees or unwise financial decisions, increased drive to perform or to achieve, increased sex drive, decreased need for sleep. It seems as if they're just ripping and running and ripping and running, and the more they rip and run, it seems as if the more energized they become. Easily distracted, careless or dangerous use of drugs and or alcohol, frequent absences from work or from school, delusions or a break from reality. We call that psychosis. They're not living in the same world that most people are in. And poor performance at their school or in their work environment. On the other hand, when you look at the depressive symptoms, there's a sadness, there's a hopelessness, suicidal thoughts, suicidal behaviors, anxiety, there's a constant feeling of guilt. They have sleep problems. They just want to stay in bed. They have no energy, low appetite or an increased appetite, very fatigued, loss of interest in activities that were once considered very enjoyable. They have real problems concentrating or paying attention, very irritable, chronic pain, and there's no real known cause for the pain. Frequent absences from work or from school. And then again, poor performance at work or school. When you talk about the treatment, how do you treat bipolar disorder? Treatment really typically requires an understanding, first and foremost, that it's probably going to be lifelong. There is no known cure for the chemical imbalances, but there are medications that are designed to help manage these mood swings. These medications are known as the mood stabilizers, and there are many of those. The earlier phases of the earlier known drugs that were used were lithium, Depakote, Lamictal, Neurotin, things of that nature. And then the other more atypical antipsychotic medications, and the reason they're called atypical is because it's another generation removed from the lithium and the Depakote, which all except the lithium, those that I mentioned above were mostly for non-convulsions or to prevent convulsions or seizures in people. But the newer medications were Seroquel, Zyprexa, Abilify, or Respirodol. Now, whether you're looking at the atypical or the anticonvulsion medications, always remember individuals taking the anticonvulsive medications or the atypical medications must be monitored on a very routine basis, typically monthly, by a medical doctor, preferably a psychiatrist, because the psychiatrist has specialized training in the medication side. In the book of Matthew, chapter 9, verse number 12, Jesus says, healthy people do not need a physician, but the sick. That word sick simply means not as it ought to be. Bipolar disorder is simply something going on, not as it should in the body. I'll see you back in class again next time. Don't be late and don't skip class.